Hi, my name is John Michael DiBianco, and I'm a urologic surgeon specializing in endourology here at UF Health in Gainesville, Florida. Today I want to discuss what to expect when considering holmium laser enucleation of the prostate, or HoLEP. HoLEP is a procedure used to treat benign prostatic hyperplasia, or BPH, which is also known as having an enlarged prostate. BPH is a condition that blocks the urethra, the tube that empties the bladder, causing urinary symptoms. And sometimes men are not able to empty their bladder at all. There are several medications and procedures that can help treat BPH, with HoLEP being one of them. Patients who are good candidates for HoLEP have symptomatic BPH and who want an effective and very durable procedure. It can be done in almost any patient with almost any size prostate to improve their quality of life, decrease their frequency and urgency symptoms, and help strengthen their stream. HoLEP is one of only a few options for patients with very large prostates, or for those who take blood thinners, or those who have already lost significant bladder function. During a HoLEP, no incisions are made. We get to the prostate through the tip of the penis and the urethra with a scope that includes a light, a camera, and a working channel. First, a laser is used to cut and cauterize the prostate tissue, and then the obstructive tissue is peeled off and placed into the bladder. We then use another device, a morcellator, to break up and remove the dissected tissue, and after any bleeding is stopped with the laser, a catheter is placed and the procedure is concluded. Most patients have the option to go home just a few hours after recovery. They will go home with their catheter and have it removed a few days later. Some may choose to stay overnight to have their catheter removed the next day, so we can measure how well they're urinating. Most patients come off all prostate medications immediately after the procedure. After a HoLEP, patients typically have some blood in the urine. They also have burning with urination and some worsening urgency and frequency issues. The urine will be red for several days, become clear, and then red again about 14 days later. For most, these symptoms resolve after a few weeks. Additionally, patients might experience urinary leakage, as the body must now adapt from having to push very hard for the urine to come out to now it being very easy. This is typically not a long-term problem after the procedure, but it can persist for up to 6 months or more. Only about 2% of patients have it persist for more than 1 year. Fortunately, HoLEP is a minimally invasive procedure that has a good track record for safety, although there are always some risks with any surgical procedure. Significant bleeding or bladder injury can occur, although less than 1% of the time. A common issue after HoLEP is urinary tract infections, which can occur about 6% of the time. Before the operation, we examine your urine, we obtain cultures, and we have you evaluated by your physician and our anesthesiologist to ensure the highest level of safety. The long-term results of HoLEP are excellent, especially when compared to other procedures. The risk of ever having prostate tissue regrow is very rare. In evaluating if HoLEP is right for you, you should be aware that HoLEP almost always causes permanent retrograde ejaculation, meaning that no fluid comes out at the tip of the penis when you have an orgasm. However, it is not known to cause erectile dysfunction, changes in your libido, changes in your penile sensation, or the ability to have an orgasm. There are other options if that concerns you. The vast majority of my patients who choose HoLEP are extremely satisfied with their outcome and the improvement in their quality of life. If you have any more specific questions or concerns, please call UF Health Urology to make an appointment.